I'm here today with Dr. John Flynn from the Australian College of Cosmetic Surgery, and he's the Chief Censor. And we're going to have a little bit of a chat about the recent changes that have been approved by the Medical Board with regards to cosmetic practitioners. Is that
correct?
Right, great.
Yes.
So, Dr. Flynn, tell us what's actually going on. Like, what does it mean for the consumer? What's happening?
Well, I think the important thing is that the Medical Board has brought out some guidelines that really crystallise what ought to be best practice in any case. And I think that's very important because it goes to protecting the consumer and it goes to patient safety. And some of the clear elements are that there should be a consultation with the patient before a procedure. But more importantly, there should be a consultation with the doctor who's going to perform the procedure.
Sure.
That allows us to set the right expectation, to impart the right sort of information to the patient, so there shouldn't be any misunderstanding about what's going to be done and what the expectation might be. We really don't want the situation where a third party or an agent, if you would, that's looking to upsell or to raise expectations beyond what is reasonable. I think, in essence, that's the key, and I think it's a very important one.
Yeah. So if you're going to see if you want to see a doctor for a procedure, the doctor is going to be the one that's actually has the consult with you before you go ahead with your procedure.
That would be best medical practice,
okay.
And that's what's been crystallised in the new Medical Board guidelines.
Okay.
And our college would be very supportive of that.
Great. So that's what we want. That's what we're heading towards.
Exactly.
Hopefully.
The other element too is the provision of aftercare.
Mm-hmm.
Now you might think that this is an automatic assumption that there is aftercare and that it's appropriate. And of course that too is best medical practice. But again, it's been formulated and regulated into a formal guideline.
Mm-hmm.
And this too is important. It's a little bit sad to think that they've had to actually do that, because you would normally expect a good, professional, ethical practitioner would provide good quality aftercare in any case.
Right.
Now, sometimes it might be by virtue of geography or maybe by virtue of particular skills that might be required should a complication occur, that the doctor might need to find an alternative practitioner to provide those additional skills or to cope with the geographical isolation. But nevertheless, it is the prime treating doctor's responsibility to make provision for that aftercare.
Sure. And how does the consumer know that they're actually visiting someone who is actually probably trained and going to perform, who's been trained in the right area and is going to actually do the right thing by them as well? Like, how do we know as the consumer?
Well, look, you've hit the nail on the head with a big consumer issue.
Mm-hmm.
And of course, what this revolves around is recognition of the specialty.
Mm-hmm.
Now, at the moment, there is no formal recognition of cosmetic surgery as a distinct specialty. Now, I would argue, of course, that fellows of our college are very well trained specifically in cosmetic surgery.
Yeah.
But the general public doesn't have any finite way of determining this. Now, if there was a proper recognition of cosmetic surgery, then there would be mandated standards and qualifications, experience, scope of practice against which all doctors should be measured. And I think that would be the best way to protect the patients.
Yeah.
In the interim, again, I would say, look for a fellow of the College of Cosmetic Surgery.
Yep.
Our college maintains what we call procedure-specific registers, and we recognise that not every doctor is equally skilled in every procedure.
Sure.
And so the specific register will allow you to look at a college fellow who is particularly accredited in a given procedure, whether that be breast surgery or rhinoplasty or facelift or whatever.
Okay. So basically, you've got to see which doctor you're going to, make sure he's got the right qualifications, make sure he's good at doing what you want to have done, and make sure he's got all the aftercare.
Exactly. And
well.
there's another really important thing. Make sure that you've got a rapport with the doctor.
Sure.
Make sure that you get on with the doctor, that you can talk to the doctor.
Yep.
Because if you haven't got that that ease of communication.
Yeah.
If you don't have that right doctor-patient relationship, then everything becomes just so much harder.
Yeah, that's so true. Well, look, if you're out there and you're having a look and you're not sure about the murky brown and want to know, just feel free to drop us an email at info@plasticsurgeryhub.com.au or just give us a call. Thanks very much. Thank you so much.
Thank you very much. Thank you.